Hey everyone, welcome to another episode of From the Soapbox. My guest today is Dr. Chelsie Estey, veterinarian and chief medical officer of Hills Pet Nutrition. She joined me to talk about the Hills' third annual State of Shelter Pet Adoption Report, which is a report they commissioned based on a survey of over 2,500 respondents from across the U.S. and Canada about their attitudes toward and experiences with adopting or fostering a pet and with veterinary care. We dove into the findings of the report, which included everything from barriers to adoption, reasons for pet relinquishment to a shelter, and generational differences among pet owners. Not surprisingly, access to veterinary care and cost of veterinary care came up as top barriers to owning a pet for many families. And while there's no simple fix for this, Dr. Estey pointed out a powerful statistic from the report about the benefit of post adoption resources that can make a big difference in keeping adopted pets with their families long term. Excited yet? Let's get into it. Here she is, getting her chance to talk from the soapbox, Dr. Chelsie Estey. All right, Dr. Chelsie Estey, thank you so much. Welcome. Thank you for coming on the podcast with me today. Happy to have you here.
Yeah, thanks so much for having me.
Awesome. Well, I'm really excited to talk about this. I just learned recently that Hills has created this state of shelters report, and that you've been doing this for a few years now. So I'm excited to kind of dig in and learn more about it and how that can affect the ways that we interact with pet owners and ways that we can sort of influence how animals do or don't go into shelters and how we can help improve access to veterinary care for all of the pets and families that we serve. And I'm curious to know if you don't mind giving us a little kind of backstory, like how did Hills decide to focus on shelters as kind of an area of study? I think it's very much needed, but I'm curious to know kind of what the story is
Yeah,
there.
no, it's a good question. And really, at Hills, we've been on a mission to help end pet homelessness for quite a while now. So, for about 23 years, through our Hills Food, Shelter, and Love program, we've provided more than $300 million in premium nutrition to feed shelter pets. And at this point, we've supported over 15 million adoptions. And we recognized a few years ago that there was still some more work to be done. We still had some gaps in sort of data and understanding. And that was really where the State of Shelter Pet Adoption report came from. It was this desire to get more data, get more information, and help fill in some of those gaps so that our partners in the sheltering and veterinary communities could have some actionable insights and we could help find more homes for these pets. And we really use this survey. So this is our third year doing this as a way to get some of that information about, what are those opportunities, barriers, perceptions for potential pet owners, and how do we help get them into that shelter community?
I love that. I love that. I mean, I've been out of vet school 20 years now, but when I graduated, I went into shelter medicine right out of school, but I don't remember there being much talk about it. And I feel
Yep.
like in the, 2 decades since, there are all these, programs at veterinary schools that are really teaching veterinary students, a lot of scholarly research behind it, and just a lot more focus on it. And I love seeing that we're really kind of being so much more intentional now than perhaps we were before about what to do and how can we make the experience, the quality of life for animals who may go in and out of shelters as good as it can be. So,
Yeah, I agree. It's nice to see more shelter rotations in the fourth year curriculum kind of popping up throughout veterinary schools. So I completely agree. We've seen that shift over time and it's been really great.
yeah. Um, and then in terms of this study, I know you said you've done it for a few years. So how did you go about that? I mean, were you working with researchers at some of these shelter programs, or what did the study look like?
Sure. Yeah. So this is our third annual Hills State of Shelter Pet Adoption Report. And it builds on the prior year. So it's presenting year over year findings. And we used a proprietary single blinded survey. So we had 2,000 folks from the US as well as 500 Canadians. And they're from diverse socioeconomic backgrounds. The survey was administered to adults over 18. They may have had a pet, they may not have had a pet. What we really wanted is a representative sample of the general population across both of those countries.
Okay, and so you were asking individuals who, like you said, who may or may not have had pets, sort of what their experiences were with adopting or fostering and veterinary care and all of those things and sort of collating that information.
Yeah, that's right. Yeah, barriers to adoption, reasons for relinquishment, just sort of getting that general understanding of what are some of those motivating factors that might bring someone into a shelter to adopt a pet. So to help, again, drive some of those actionable insights for our sheltering partners.
And you said this is the third year, so this started post COVID.
That's right.
Okay. Yeah,
Yeah.
because I think one of the things that I think about the most when I think about shelters recently is those images of back during COVID when,
Yeah.
we had these like puppy booms and everyone wanted a pet. And you would see these social media posts where, there would be the shelter that had no animals in it. There'd be all the
Yeah.
staff like standing in open cage, runs and they had adopted out all of their pets. And of course, we were all very busy in general practice and probably all
Yeah.
kinds of small animal practice because of all the pets that people were adopting from everywhere. And now I imagine it's a very different scenario in shelters. I know you weren't measuring these kinds of things back during COVID, but like how would you characterize the situation now?
Yeah, we know from the shelter animals count data that there were 5.8 million pets that entered shelters and rescues in the US in 2024. But if we look back at the pre and post COVID data, so if we compare the 2019 information versus 2024, we did see that intakes in 2024 were down 11%, but adoptions were also lower. So adoptions were down 5.6%. And we know that some communities definitely saw that increase in adoption. There was that boom that happened during COVID, and we saw some of those nationwide trends. But overall, the intakes have been outpacing outcomes from the shelters for 5 consecutive years now. And so what that means is we're fueling this ongoing capacity crisis. And so just for to give you an example, so in 2024, we saw 103,000 additional pets added to the overall shelter population.
Wow.
Yeah.
Okay. All right. So, and do you know how that rates to like shelters being at capacity now or close to being at capacity or turning away pets? Do we know anything about
Yeah,
those numbers?
we didn't dive into the specifics by shelter in the report, but certainly from our shelter partners, from those relationships, we know that the shelters across the US are certainly still facing a capacity crisis. And it varies. Again, there's some regional differences depending on the type of city and kind of metro area that the shelter might be in. But generally speaking, there's definitely a significant capacity crisis across the US affecting the sheltering community.
Okay. And then I noticed I was kind of going through the report, the findings, and I saw that it was broken down into different sections. So, kind of like you said, this was the asking the general population, so asking what they think about shelters, what their perceptions are, what they think about adopting from a shelter. Why might they not adopt? What barriers there are? Their experiences with fostering, if they've had any, and then any experiences with like surrendering, if they've had to do that. Um, and then I kind of honed on this, unsurprisingly because I'm a veterinarian, but I saw that it said, access to veterinary care and specifically, the cost of veterinary care was noted to be the number one barrier to owning a pet year over year. And I don't think that's a surprise really to any of us because we're starting to talk about cost of care, a lot more. I guess I'm just curious, was this tied to their ability or motivation to adopt? Was this a reason that they gave as to maybe why they wouldn't want to adopt a shelter pet or a reason why they might be more likely to relinquish a shelter pet? Was there a relationship there?
Yeah, so the report found that the cost of veterinary care was consistently viewed sort of as the most expensive part of pet ownership, and that financial concerns in general were one of the top barriers. Just the overall cost of owning a pet was one of the top barriers that we identified in the report for a potential reason that someone may consider not acquiring a new pet. And then when we looked directly at sort of that decision to adopt as we link it back to the cost of veterinary care, we saw that that concern was mentioned about 64% of Americans in the report. Um, We did find, though, that 20% of respondents just cited general financial concern, general financial difficulties as a factor when considering making this decision. So we can't say for certain that veterinary expenses were, a core driver, particularly as it relates to relinquishment. We know that financial strain overall was a significant contributor. So when we looked at relinquishment in particular, we saw housing, financial concerns, and actually concerns around training and behavior were the top three reasons why someone was considering relinquishing a pet.
Okay. Yeah. I feel like that probably fits with a lot of with what a lot of us probably hear
Yeah.
from pet owners, from clients. So yeah, that's interesting to know that that's what your research showed as well. Um
We know. Oh, sorry,
yes.
I was gonna
No,
say
no,
we
go
also
ahead.
know from some of our partners as well, they are working on some initiatives to make care more accessible. So the Louisiana SPCA has implemented a bill pay system so people can pay for emergency vet care in installments. We're seeing other shelters come up with low cost options, low cost veterinary services, again, to help address some of those financial concerns and make adopting a pet feel more accessible for a potential pet owner.
Yeah, I love that with all of the discourse that we have in the public around cost of care and the perception of veterinarians and veterinary medicine. I'm glad to see that, and I think that needs to continue to be part of the solution. I think we all want to see more of that. Um, and then just kind of like separate from cost, although perhaps related to cost, there was a lot of information in the report about access to care broken down by generation, sort of the age of the pet owner. Was there anything that really stood out to you there or surprised you or
Yeah, it was interesting. The access to care challenges went beyond cost. And so, what we saw is that certain individuals cited concerns around reliable transportation to the vet, proximity to the veterinary clinic, and even just availability of appointments. And then, when we dig into those generational groups, the report found that Gen Z and millennials are more consistently likely to report that those access factors were potential barriers for them to adopt compared with Gen X and baby boomers. And so, what I think this suggests that there may be this accessibility gap that's felt by some of these younger generations that we could really target from a support, resource, education standpoint to try to get them into the shelter community and consider adopting one of these pets.
yeah, I feel like with so many other parts of society where we just are learning that newer generations want things done differently, need things done differently because they face different challenges and different access to technology, and we kind of are forced to sort of grow with the times, which is not necessarily a
That's
bad
right.
thing.
Yep,
Um,
that's right.
yeah. Um, and then I was sort of surprised. I guess I just hadn't thought about it this way before, that there were generational differences in terms of wanting to or feeling some sense of pressure to sort of provide gold standard, kind of quote unquote gold standard veterinary care for pets. Um, as in, I think it was the younger generations were feeling more pressure to do that. Is that right?
Yeah, we saw that the younger Americans who are surveyed, who are more likely to adopt, were the ones that often also felt that accessibility gap and potentially, a pressure to meet a certain gold standard, which could then lead to hesitation or guilt around adoption. And I think that that's where there's really an opportunity for education and support. And that can begin in that first conversation. So if one of these individuals comes into the shelter, right, that counseling conversation just to discuss what does that person's lifestyle look like, right? What are they looking for in a potential pet? So I think there's an education piece that can happen within the shelter, but I would say it also may happen at the veterinary clinic, right? That may be a conversation that a veterinarian is having with someone considering adopting a pet, or even after they have at that first puppy or kitten appointment, to just emphasize, right, that committed care is enough. And I think that that really underscores that need for a spectrum of care approach and finding that best possible solution within a client's means, openly discussing different diagnostic options, different treatment alternatives, preventative care plans, and figuring out how to make it work for that pet owner and keeping that pet and pet parent together.
Yeah, there are so many different sort of variations of the term spectrum of care. I don't think I've heard the term committed care though. How do you define that?
I think I would what I mean by that is more just around, that they're committed to working with the veterinary healthcare team to find that balance, right? To find what works for them and their family and for their pets. So it's really just it's that spectrum of care approach.
Yeah, I like that, just kind of being committed to doing what you can
That's
is
right.
all we can reasonably ask. And speaking of sort of different terms, with the community care guidelines that we released not that long ago, we talk a lot about sort of replacing the idea of the gold standard with the concept of family-centered care, not to confuse things more, but that idea that we're centering the whole family relationship, the pet and anyone in that household, whether it's one person or a whole family or, roommates, whatever that is, they're considered the family of that pet and really taking into account all of their needs, challenges, level of understanding, cultural factors, all of that that might affect, and like you said before, transportation, mobility, all that stuff that
Right.
might affect their ability, their desire, um, all of those things to accept care and what that might look like and what's best for them and their pet. Um, and I'm wondering, like, if there are any specific stories or examples that kind of come to mind to you from this work that might sort of highlight how these concepts apply to sort of different generations. I know you mentioned the idea of like younger generations and perhaps like proximity to the veterinary clinic. Are there any other sort of stories or examples that you can think of that sort of underscore those differences that veterinary practices should keep in mind when they're figuring out how to reach their clientele?
I guess the from the report we don't have any specific stories that we kind of fleshed out within the report, but I would say, right, we know that the younger Americans who were surveyed were more likely to adopt when versus some of the older generations who responded. And I think it comes back to some of the points you just mentioned around transportation, proximity to the clinics. I think there's an education opportunity there. So even it may start that if there's a veterinarian that's involved in the conversation, if they're aware of the resources that exist within their own community, that could be one potential option where they may be able to help partner and facilitate the relationship between a shelter and this individual that might be considering adopting. But there's just I think a lot that happens within the shelter, within those initial conversations when someone walks in the door around what are they looking for, right? How do you best find that match with the pets that are currently available in the shelter? And it's probably having that open, honest, transparent conversation around what their expectations are and what they may need to do as a new pet owner so that we are equipping them with the knowledge that they need to help address some of the concerns that they may have around anxiety of becoming a new pet owner or things like that. And then knowing what support exists after, I think, is a really critical piece there too. So that if they do find themselves in a situation like we talked about earlier, where they're considering relinquishment or they're just not sure it's quite working out in the way that they had hoped, they know that there's a lifeline there. They know that they can reach back out to the shelter or to their veterinary community for guidance, for support, for treatment. I think that that's another really important piece there.
Yeah, yeah, I was thinking about that when you first started talking about education, educating the pet owners, from the moment of the adoption and then the veterinary clinic. And the thought that I was having is also this idea that like we need to continue to educate ourselves, which I think, we're all working on doing and we want to do as a profession in terms of the ways that um we can show up in ways that are helpful and appropriate for families. And I think we all know, any of us who have spent any time in an exam room will know that we hear so many details about
Yeah.
families' lives,
Yep.
things things that we,
Absolutely.
quite frankly, are not equipped to respond to. Things about their personal life, things about
Mhm.
sometimes their mental health, their financial situation, their living situation, all of these things. And I think, and they definitely affect, and the reason that we hear about them is because they're often being given in an explanation of perhaps why they can't say yes to
Yep.
whatever's being presented to them. And I think so many of us feel so helpless because we're like, we want to help. Like, I wish I could
Absolutely.
buy you a car, or I wish I could
Yeah.
help you find a new place to live, or get away from your abusive partner, or, that's an extreme example, but, all of these things. I wish I could help you find a job, all these
Oh,
things that obviously we can't do.
that's right.
And they end up affecting, in some cases, our ability to treat the pet. But even apart from
One
that, I think we are generally just a very caring profession, and we want to be able to help the humans too.
That's
Um,
absolutely right.
and it's hard to feel like we can't do that. Like, there has to be a boundary somewhere. Obviously, we have to stay in the veterinary clinic and take care of the patients, because otherwise everything would come to a grinding halt. Um, but I think we're at least trying, and we're starting to learn more about how we can perhaps reach out and find what those other resources are in the community. At least know what they are, so that we know, where to send somebody.
That's
Um,
exactly it. Yeah,
who,
sometimes it's just being a source of that information.
yeah, yeah. And we hear about these sort of allied professions like veterinary social work, and unfortunately, they're not every clinic has
Yeah.
a social worker. So sometimes we think, okay, well, what do I do? Who do I call? Like, where do I send people? Um, and I'm excited that the AHA has just released the One Health guidelines, which is the first time that we've had a guidelines where we had MDs and DVMs and RNs and all of these different social workers kind of come together and talk about how can we work together to support the health of both the animal and the human, so that they can keep each other healthier, so that they can stay together, all of those things. And I'm hoping that that's just the beginning of more partnerships like that, because I would imagine that's going to be really key to keeping some of those families together,
Absolutely.
keeping
Yeah,
those
I love
pets in
that
their
sort of
homes. Um,
team-based collaborative approach. I
yeah,
think, yeah, is so
yeah,
critical.
yeah. I'm excited. I'm really excited to see a lot more of that, and I hope that we will really be able to feel like we are part of sort of just a bigger team of healthcare workers that's going to work together to support everybody.
Yeah, absolutely.
Looking for the latest veterinary news? Stay ahead of the curve with stories from the American Animal Hospital Association's digital, award winning newsroom, Trends. We're bringing you fresh stories every day, covering everything from the cutting edge clinical insights to helpful practice management tips. And it's not just articles. Watch videos, check out interactive charts, and learn more about the people shaping our industry. As an AHA member, you also unlock exclusive members only content designed to help you and your team thrive. Visit aha.org/trends today and sign up for Trendsetter, our newsletter where all of our stories are delivered to your inbox twice a week.
Just kind of going back to the report, um, were there any other like solutions that the report found besides what we've already talked about um, that you feel would be helpful in terms of ways that pet owners and those who want to be pet owners can feel more confident in accessing veterinary care for their pets? I mean, I know we've talked about a lot of that already, but is there anything else that stands out to you, that would be helpful?
Yeah, I think we've covered a lot of it, right? It's just the veterinary healthcare team plays such a vital role in, I think, this particular issue, and partnering with shelters and the pet owners to make care more accessible. And I think there are lots of great post-adoption support programs that shelters offer. It may be vaccine clinics, pet food pantries, mobile clinics, subsidized care. So back to your earlier point around it, sometimes it's just knowing that that exists, to share that as a solution or an option for that pet owner that may be struggling to provide the type of care that they might want, or to access even nutrition, right? In that case, where if there's a pet food pantry, in their community, that can be a resource that they might be able to share with that particular pet owner. And I think the other thing is normalizing seeking help, right? And reassuring owners that it's okay to use these support systems. That's why they're there. We want to keep pets and their pet owners together. And I think if we can empower these pet owners to seek veterinary care with greater confidence and feel like they can have an empathetic, open conversation about maybe the things they're struggling with, we'll be much better equipped to help them get the care and solutions that they and their pet need.
I think that's such a good point because, it's one thing for the resources to be there for someone to have to kind of ask for them and say, well, isn't there someone who can help me? Isn't there something I can do? And then it feels like that can be kind of an icky feeling. You feel like, oh,
Yeah.
I'm asking for help. Whereas if it's being just kind of set out there from the get-go, like, here's this, use it.
Yep.
We expect you, if you have a need for it, to avail yourselves of this option.
That's
and it's
right.
there. Yeah, I think that can make a huge difference. And some people are going to feel comfortable saying, hey, I need this, I need help. But a lot of other people may not.
That's right.
Um,
Yep. Right.
and then just kind of like staying on that idea of some of the emotions that can go along with
Yeah.
asking for help. I saw that there was a part in the report that talked about emotions, both positive and negative, that were associated with adoption from a shelter, and they were stronger in the younger generations as
Yep.
well. Can you explain a little bit more about that? Like what kind of emotions they were looking at and sort of what they found?
Sure. So what we saw was that in Gen Z and millennial respondents, they were more likely than the other generations to experience strong emotions after adoption. So that was both positive and negative. So we saw 70% of Gen Z and millennials reported feeling excitement post-adoption, but 17% reported feeling anxiety. And that was compared with 52% of those that were feeling excitement and 9% for anxiety when we looked at that older generation. So the emotions were just generally stronger in the younger respondents in the survey. And I think that, again, it comes back to really what we've been talking about around that family-centered care approach, around the having them feel comfortable accessing care, openly asking questions, seeking guidance from their veterinary healthcare team members. And again, knowing that we're providing some of that support, both for them as a potential new pet owner, but also creating that relationship long term. If they're coming in for that first visit, that's where we can, I think, really have that impact and set that foundation for hopefully all of the future visits that could happen, any other issues that may come up down the road, that they feel that they've got a support system in their corner.
Very good to know. So just kind of like generalized anxiety. So it could have been anything of like, I hope I hope I do a good job, to I don't know how to train my puppy, or
Right, yeah,
kind
we
of
didn't
anything.
dig in. It could have been, yeah,
Yeah,
a broad spectrum, but I'm guessing that those were probably some common feelings that may have come up in a new pet owner.
for sure. I can only imagine. It's been a long time since I've had a puppy, but I can only imagine. Um, and then there was the one statistic that really stood out to me that I wanted to call out. And that was that of those who had pets that were at least thinking about surrendering them, 95% of those people who received resources or support ended up keeping their pets.
Yeah.
That's
Yeah,
amazing.
it's a really powerful statistic. And when we come back to those reasons for relinquishment, the most common factors we saw were housing limitations. And again, we're seeing that as a bigger factor in the younger generations where there may be housing restrictions around the housing options that they're looking at. The second was around financial strain. And then the third was training or behavioral issues. And, we've talked a lot about this already, but it comes back in some cases right to that education. Like, what are those resources that exist from a training or a behavioral standpoint to help keep that pet and pet owner together? And from a housing financial standpoint, again, I think it depends on the specific circumstances, but it may just be an access to care. If there is a vaccine drive or a spay and neuter clinic, that may be the solution that that particular pet owner needs. And, like you said, right, 95% chose to keep their pet when they were provided with some resources in that post-adoption timeframe where they were considering relinquishment. So it's just such a critical period for the veterinary healthcare team, for the sheltering partners to be able to show up with some of those resources to help get that pet owner through whatever that challenge is that they're facing.
Yeah, that's so powerful. And I mean, most pet owners don't want to be separated from their
That's
pets.
right. Yeah.
Um, and I think we all want to do what we can to help that family unit stay together. So that's encouraging. That's encouraging that there's so much we can do to keep them together.
Yep.
Um, and then there was also a lot of work that you did on fostering.
Yeah.
Um, and I didn't get to dig into all of it, but I did see mention of foster fail, and I'm just I
Yeah.
mean, is that in the sense of like you didn't work out because you
Keeping.
kept the pet? All right,
Yeah,
so I was
exactly.
hoping that was the context of it.
Yeah, this was a really interesting topic. It's probably one of my favorite parts of the report. And what we saw is that 65% of people felt that fostering was a positive way to try out pet ownership, but only 1 in 10 have actually fostered. And when we dug into that further, it's exactly what you called out. 47% were worried about that foster fail.
Okay.
It was on we were talking about this with another colleague probably a couple months ago, and they had coined the term foster fortune. So maybe that we can switch it to
I
that. But
love
ultimately
that.
there was anxiety and concern around potentially keeping the pet that they were fostering. But there's a lot of really innovative ways that shelters are approaching that fostering experience. So we're seeing certain shelters offering like a dog's day out, where maybe you take a pup out of the shelter for a day and you go on a hike, or you get them out into the community. They're doing doggy sleepovers. We're seeing some even target specific breeds because large breed dogs are unfortunately spending more time in the shelter. Their length of stay is longer than smaller dogs. So we're even seeing some targeted campaigns around, the large breed dog, take them for the weekend, have a sleepover. And that gives us a couple of things, right? It gives an opportunity for that pet to get out into the community and potentially find a new pet owner. And it gives us really valuable information about those pets. How do they do in the car? How are they doing if they go, on a walk and they interact with some other dogs? And that lets the shelters create a more robust bio for that pet, hopefully have more information for that future pet parent. And it ultimately, in some cases, for the longer fosters, it frees up space in the shelter as well. So for new pets to be able to come in and potentially find their new home. The other thing we saw is that 59% of prospective folks considering foster were concerned about cost, and they said that if costs were covered, that they would in fact foster. And that number went up to about 71% in the younger populations. And so there's another opportunity for education there. Is most of the time fostering requires minimal financial investment. So most of the shelters do provide all of the necessary supplies, veterinary care, food, all of those things during that foster period. So it may be more accessible for folks than what they realize. And it is just such a critical lifeline for our shelters to help, one, get those pets out into the community, and two, just give them an opportunity to get out of that shelter environment, maybe decompress a little bit, and hopefully find their new home.
Yeah, get some enrichment.
Yep,
Yeah,
that's right.
I've seen some of those videos on social media where, like you said, someone's like, "I'm gonna check out this dog for a day, and we're gonna go
Yeah.
for a hike." And I'm like, "Oh, well, that dog, I'm sure they're working on you the whole time.
Yeah,
Like,
exactly.
now's your moment."
That's
And
right.
a weekend, that should be long enough for a good percentage of those people to fall in love with those dogs and
Yeah,
not
and
wanna
figure
take
out
them
if
back.
pet ownership is for them, right?
Right,
Even if
right.
it's not that exact pet, that they may they may give them the confidence. You know what? I can do this, right?
Yeah.
I managed through 2 nights. We did, we went on a hike. We did those things. I can definitely take this on, and I think that's another really important way to get a new pet parent into that shelter community.
Yeah, I love that idea of, like, building confidence. You spoke to the
Mm.
anxiety before.
Right?
What a great way to help overcome that, to
Yeah.
see that they can do it. Um, This is very exciting to me. I love all the innovative ways that shelters are working to make life better for the pets that they care for, and um, hopefully help um, more family units stay together. You think of all the things on social media, like all the photo ops, the photo
Yeah.
shoots that they do, all the creative social media posts that are trying to really get word out, get the public more aware. But I think it's so helpful for us as a profession to also be aware of what's going on and all the ways that we can help improve things for pets and their families. So thank you so much for sharing all of that with us. I'll be excited for others to sort of dig into the report and see what they learn. And just on that topic of excitement, I'd love to know something that you're excited about in our industry, either something that's happening now or something you're looking forward to in the future.
Honestly, I think I would say innovation in general.
Yeah.
I love when we think about, where veterinary medicine was 15 or 20 years ago and where we're going now. And I mean that in the pharmaceutical space, in the pet nutrition space, diagnostics. There's just so much innovation happening all across the animal health industry that it makes me excited for the future when we think about new ways to treat disease and how to elevate that quality of care that we're providing our patients. I think that it's an exciting time to be in veterinary medicine as we see how that landscape changes. And I'm sure even in 5 more years, right, we're going to be practicing differently. We're going to be using different tools in our tool belt. And I think that that's the thing I'm most excited about, is just to see how that innovation continues to evolve across the industry.
Yeah, sometimes it's amazing to really think back on how much things have changed just
Yeah.
even in the past 10, 20 years, like you said. So much has changed, and it's very exciting. So thank you for sharing that. And I'd love to just give you the opportunity, if there are any other final thoughts you'd like to share with our audience, or any ways that they can reach out or learn more if they want to follow along on updates on shelter studies or other work that's going on.
Sure. So if any of the listeners would like to dive deeper into the shelter report that we discussed today, they can head to hillsshelterreport.com, where they can download the report, get through. There's lots of really great images and analytics that help kind of digest. It's a robust report. We covered a lot in all of those pages, but there's some really great insights to pull out, and I hope the listeners will find that helpful. So again, that's hillsshelterreport.com.
Awesome. Thank you so much. Thank you so much
Thank
for
you.
spending time with us.
Oh, thanks so much for having me. It's been great.